Assalamu alaikum to all of you. I am Umar Qureshi from Dr. Sirajul Islam Medical College and I am in the 4th year. I am the team member of the Medimartt. Medimartt is a platform for the medical students. As you all know that we are regularly trying to share some short videos on different topics. So today we come with another video of the basics of the heart. We already shared the 4 parts of the basics of the heart. You can watch those videos from our Facebook group or from our YouTube channel. Okay, and for the link, we will insert the links of those videos in the description box of this particular video, inshallah. Okay, so let's move towards our topic. And before starting, I want to inform you that our reference book is A.K. Datta. You can check it out, and we have inserted the page of the A.K. Datta. In our previous class or in our previous video, we discussed about the base of the heart, means some part of the base of the heart. So today it's also related to the base of the heart. These are the features. Okay, so we will discuss all the features. Okay, so as we all know that this is the base at this position. This is the base. Okay, so what A.K. Datta is trying to say in its first point, that superior vena cava opens in the upper and posterior part of the right atrium. So this is superior vena cava and this is the posterior part. So superior vena cava opens in the upper, as this is the upper part, and the posterior part of the right atrium. Then inferior vena cava opens in the lower and posterior part of the right atrium. Okay, so this is the inferior vena cava. So inferior vena cava opens in the lower part. This is the lower part, and the posterior part. This is the posterior part of the right atrium. This is the right atrium now. So that's why it is saying that superior vena cava opens in the upper and the posterior part of the right atrium, and inferior vena cava opens in the lower and the posterior part of the right atrium. So this is the point. Then the next point is 4 pulmonary veins, 2 on each side. Okay, let's see where are these 4 pulmonary veins. So basically you can see that these are the 4 pulmonary veins. Okay, this is a pair of pulmonary vein, and these are this is also a pair of pulmonary veins. Okay, so 4 pulmonary veins, 2 on each side, here 2 and here 2. Okay, so open in the posterior surface of the left atrium, as this was the right atrium and this is the left atrium. Okay, so the 4 pulmonary veins, the 2 on each side, opens in the posterior surface of the left atrium. This is also the posterior surface and this is the left atrium. So what A.K. Datta is trying to say, that 4 pulmonary veins, 2 on each side, open in the posterior surface of the left atrium. So this is the point. Then these 6 veins are enclosed in a single tube of serous pericardium. Which 6 veins? These 2 pulmonary veins, then these 2 pulmonary veins, 4. Okay, then the superior vena cava and the inferior vena cava, it is all in total 6 veins. Okay, so what A.K. Datta is trying to say, that these 6 veins are enclosed in a single tube of serous pericardium. Okay, which is arranged in the form of inverted J shaped. You don't have to understand it much, just understand that these all are like inserted or enclosed in a single tube of pericardium. Okay, because what is pericardium? Pericardium is the outer covering of the heart. Okay, so these 6 veins are enclosed in the single tube of pericardium, means understand that this is a tube. Okay, so these all superior vena cava, inferior vena cava, the 4 pulmonary veins, these are all enclosed in the single tube of the pericardium. Okay, just like that. So this is the point. Then the shape of it is inverted J shaped. Okay, so this is J, so it is inverted J shaped. Again I will draw the inverted J shaped. So this is the inverted J shaped. This will be like that. Okay, enclosed in that type of way. You don't have to understand much, just you have to show that it is a J shaped and it is called as the oblique sinus. Okay, so these 6 veins are enclosed in a single tube of serous pericardium, which is arranged in the form of inverted J shaped. Between the limbs of J, the posterior surface of the left atrium forms the anterior boundary of the oblique pericardial sinus. So this is the posterior surface of the left atrium, it forms the anterior boundary of the oblique sinus. Okay, what is oblique sinus? This is a oblique sinus, it is inverted J shaped. Okay, so and the posterior surface of the left atrium, it is forming the anterior surface or the anterior boundary of the oblique sinus. Okay, so that's it, you don't have to understand much. When your teacher will ask you show the oblique sinus, you just have to show just like that, you have to like invert your finger and you have to show like that. Okay, so that's the point. Then the next point is a shallow vertical interatrial groove may be found between the two atria and indicates the posterior attachment of the atrial septum. This is also not very much important point, okay, but we will understand that a shallow vertical interatrial groove. Now what is interatrial groove? As you know that this is the left atrium, this is the right atrium. So this thing over here, this groove, you can see this groove is called as the interatrial. Inter means the between, okay, and atrial means the two atrias. Okay, so interatrial groove. So a shallow vertical interatrial groove may be found between the two atria, okay, and indicates the posterior attachment of the atrial septum. Now what is atrial septum? Atrial septum, like you will understand the atrial septum in the embryology classes, in the embryology videos, inshallah. So just remember this thing that it gives the posterior attachment of the atrial septum. Just remember for right now, don't go into deep because it's a vast topic. Okay, so that's it. Then the next point or the next thing, we are going to the vertebral levels. Now what are the vertebral levels of the base? Okay, as we are studying about the base, now what are the vertebral level of the base? In recumbent supine position. What is supine position? When a person is sleeping or a lying position. Okay, like this is a bed. Okay, when a person is sleeping or in a lying position, so the base of the heart lies opposite the bodies of the 5th to 8th thoracic vertebra. Okay, assume that the base is this. Okay, and there are certain vertebrae over here. Okay, just like that. Okay, so the base of the heart lies opposite to the thoracic 5 to thoracic 8 vertebra. This is in the supine position. Okay, now when a person is standing, okay, it lies to the thoracic 6 to the thoracic 9, thoracic 6 to thoracic 9. Okay, so that's it for today. If you love the video, then please do mention your friends, please do like tag your friends, please do share as much as possible because it gives us motivation to make more videos like this. And thanks a lot.